So I presented the results of the FRAME study at ESMO 2021. And this was a phase 1 study of a combination of a dual RAF-MEK inhibitor, VS6766, and a FAK inhibitor called defactinib in low-grade serous ovarian cancer. So a bit of background about this disease. It is a rare subtype of ovarian cancer, accounting for up to 5 to 10% of serous carcinomas. And the problem is that for recurrent disease, the response rates to conventional systemic therapy are too low, so 0 to 13 or 14% for chemotherapy or hormonal therapy. Now, the MAP kinase pathway is an attractive target. It plays a prominent role in the pathogenesis of low-grade serous ovarian cancer. And we know that around 30% of low-grade serous carcinomas harbour a KRAS mutation, and up to 70% may have a RAS pathway-associated mutation. So MEK inhibitors have entered clinical trials in this space, and response rates are 15 to 26%. So, for example, I was involved in 2 phase 3 studies, which we took part in at the Royal Marsden. So one of the MEK inhibitor trametinib and another one of binimetinib. So trametinib showed that there was an improvement in progression-free survival of 13 months. PFS was 13 months versus 7.2 months with standard of care. The discontinuation rates due to adverse events was 35% compared to 12% with standard of care. And what we know from the binimetinib studies is that although there wasn't an improvement in the randomized study with the MEK inhibitor compared to chemotherapy, that the presence of a KRAS mutation was associated with longer progression-free survival in patients treated with binimetinib. So there is a strong rationale to continue looking for MAP kinase targeted directed therapy, and in particular to try and overcome resistance. And that's what this trial targets. There's preclinical evidence that MEK inhibition can induce this compensatory activation of phospho-FAK, which can stimulate ERK signaling and through a FAK-dependent pathway. And this reactivation can be an escape mechanism. And so with dual targeting, we may be able to combat that. The FRAME study is a phase 1 study, and so we used a standard design for a dose escalation design and then an expansion. And we had expansion cohorts, including RAS mutated tumour cohorts, but a specific cohort for patients with low-grade serous ovarian cancer. And we presented the dose escalation results of this novel oral intermittent schedule of VS6766 and defactinib at AACR in 2020. So what we saw in the low-grade serous ovarian cancer cohort of the FRAME study is that the confirmed response rate in all patients with low-grade serous ovarian cancer is 46%. So there were 24 evaluable patients with low-grade serous ovarian cancer. In the patients that had a KRAS mutation in the tumour, the response rate was higher. This was 64%. And I'd like to point out that we have seen responses in patients that have previously been treated with a MEK inhibitor. The median progression-free survival overall for all patients with low-grade serous ovarian cancer in this study so far to date is 23 months. In terms of side effects, rash, CK elevation and diarrhea were the most common adverse events, and the majority were grade 1 or 2. In total, there were 32% of grade 3 or 4 toxicities, and only 1 patient to date discontinuing due to an adverse event. Well, I'm very excited about these results, and I very much hope that this is going to potentially change the standard of care for women with ovarian cancer. So in May 2021, based on the results from the FRAME study, the FDA granted breakthrough therapy designation for VS6766 and defactinib for the treatment of women with recurrent low-grade serous ovarian cancer. And based on this, these results, a registration-directed phase 2 study called RAMP 201 is underway. And I'm delighted to be the global lead of this study. It's an ENGOT-GOG Veristem collaboration, and the trial is recruiting in the US and the UK and is about to open in other countries in Europe and Canada. As an anecdote, I shared the case of a patient treated within the FRAME study. So a 77-year-old lady who had previously had surgery twice and 4 lines of systemic therapy for low-grade serous ovarian cancer. And she was treated with VS6766 and defactinib since January 2018. And over 3 years later remains in partial response, continuing treatment. So I very much hope that in larger clinical trials, we'll be able to see more about the effect and value of this treatment. And I very much hope that this will be a new standard of care in the future if successful. So based on the phase 1 FRAME study, which was an academic-sponsored study, we now have a registration-directed phase 2 trial called RAMP 201, which is underway. And I'm delighted to be the global lead of this study, which is an ENGOT-GOG Veristem collaboration. The trial is recruiting in the US and UK and is about to open in other countries in Europe and Canada. So in this study, we'll be looking at the combination and also looking at VS6766 alone, and specifically in cohorts of patients that have a KRAS mutation and also those that don't. So a lot of translational work will be part of this study, and I'm very much hoping that we'll be able to see what the true efficacy and side effect profiles are in a larger number of women with low-grade serous ovarian cancer. And I very much hope that this could change the standard of care for women with low-grade serous ovarian cancer.